As Lagos residents continue in the celebration mood after the inauguration of Babajide Sanwo-olu as the 15th governor of the state, they have also compiled a to-do list for the new government in the area of health care delivery. Expectations are high for Governor Sanwo-olu to surpass his predecessors, not just because of his track record in public administration, but also due to the existence of a template instituted and operated by his predecessors. For the residents, there is need for better access to quality health care and reassurance of affordable, accessible, and equitable services in the health sector. The new governor has an idea and already made a commitment since his emergence as the governorship candidate of the All Progressives Congress. His campaign promises on health included boosting the Lagos State Health Insurance Scheme to reach 500,000 households by the fourth quarter of 2019, expansion of the Lagos State Ambulance and Emergency Service coverage by increasing the number of ambulance points from 15 to 23, and having a minimum of 3 doctors, 3 nurses, and 5 community health workers in all 345 primary health care centers by 2021.
When you have just less than 20% working, then technically people don't have availability or access when they need it. And unfortunately, primary health care is the crux. That is where 80% of people need to go to when they fall ill, because we know by statistics and data that predominantly we go to hospital for primary health care services, pain and, minor ailments, malaria, typhoid, and so on and so forth. So if we can fix a primary healthcare system, which is the closest to the people, then we will make tremendous progress towards making healthcare available.
Lagos State has even gone a bit more than just the action plan, and recently they launched their biobank. They've actually got Canadian support of the Canadian government, went forward to ensure that we actually begin to have things in place to ensure that we even now can start to develop our own vaccines. If we have to depend on the WHO abroad, it's not a sustainable model. So the action plan is a first step, but beyond that now we have to begin to make investments into ensuring that it happens. Because one thing is to have the plan, another thing is to implement.
He also promised to create a Lagos Volunteer Corps to support the health sector and check medical tourism, while also delivering medical parks and giving needed support. The State University Teaching Hospital LASU to become a medical center of excellence in at least 2 specialties. Governor Sanwo-olu also plans to increase spendings on health from 8.86% to 15% of state's annual budget.
Let's create social solutions, partnering with the private sector for economic gains for them. The budget of Lagos State on health is inadequate to take care of even one hospital. The whole budget for the year cannot take care of one hospital adequately. So let's spread this money as a rental cost for equipment to be provided, to be managed by those who provide it, and we'll pay for the service they are rendering. Let's try it. If we don't burn our fingers, we don't know where to put plaster.
First of all, they must make a political commitment, and 2, put the money where the mouth is. In other words, allocate enough funds and make sure that these funds are judiciously and properly used. I think that is it. I think the framework is good. The plan of action is good. I commend them for that, and I think more and more states should adopt that. But Lagos State is unique in the sense that it has money, it can afford to do that. But having said that, the management of that fund is also critical. So all one can say is to wish them well.
Another area residents want an intervention is the brain drain syndrome plaguing the sector. They want the government to devise means of arresting what many regard as a serious threat.
Government has tried in many aspects to understand PPP, to go into PPP. We've done road infrastructure on PPP. We've done so many things on PPP. But the area we've not really understood and we've not tried our hands on is service. We're concentrating on physical infrastructure, we need to concentrate on service. Let's buy service in health sector. We have so many equipments in the cages that were not brought out. When they were brought out, we don't have people to manage it. When they have force, we have to spend fortunes on them to bring them back to functioning.
Experts believe the state, with its huge population, should increase awareness about sexual and reproductive health rights issues, especially in the area of family planning.
We want to prove in the Bible that God said, "Go ye and multiply," and they stop at that level. They don't go else. They don't go further to expatiate more on that, and they use that to convince a lot of people. But it is wrong. God said, "Go ye and multiply." Yes, He's giving us that concept that we have to reproduce ourselves. But He doesn't say, "Go ye and just spoil the world or the earth with human beings you can't cater for." And like I used to ask people, I said, multiplication starts from what? Multiplication starts from one. So if you have one child, you have multiplied. We talk about it, everybody is free to talk about it, then it becomes round. The government too is going to take it serious. That yes, we need to vote certain things in these areas. It wouldn't be left only for the NGOs. The NGOs will come and go. Government will remain. The people remain. So government too will take it up to now make sure that things are made available for people to do. Because once it's available, you go to some clinics, no family planning and presence is fair.
If you're running a state that has the largest, in terms of challenges and opportunity, obviously there will be a lot of comments that will be made about you. And a lot of our development partners also understand that if they can get it right in Lagos, they will begin to not only reduce the challenges around poverty, but they'll be getting it right in Nigeria and by extension, sub-Saharan Africa. So it's a daunting challenge, but it's something that we're settled in, we're wired up to do, and we're believing that we'll give it a very...
Healthcare is non-negotiable. Lagosians are hopeful Governor Sanwo-olu will bring about a new, improved sector.